this as well.
Okay.
Mhm.
So I just got it here now. I don't know if I understand. So we will just do the presentation. You'll record it and you'll upload it later. Is that it?
Yes,
So,
yes, that's gonna be the process for today.
Okay.
And Rita, great to meet you, great to see you, and it's a great pleasure that you could join us today.
Thank
So I
you.
will just say a few words for the intro, and we can take it from there.
Okay.
So hi, it's a great pleasure to welcome you all on our next webinar in the series of mental health acceleration. And this webinar series is brought to you by Tartu Biotechnology Park and Scanbot jointly with Tartu City, and this is powered and financed by EIT Health RISA program. And today we have with us Nevaro team, and they will tell us about their story. So it's about how a startup can find financing while working on their mental health application, and what kind of sources to look for, what kind of best practices there are, and what certainly to avoid. I'm hoping you will provide us with both examples. And it's a great pleasure to have with us Francisca and Rita. And please, the floor is yours.
Great. Thanks a
Thank
lot
you.
for the
Thank you so much for the invitation and for this amazing intro. So we will take a look of our path so far. So how we started, how we got here, and how we managed to survive in between.
Mhm.
So I'm going to share my screen. Please let me know if you see it.
Yeah.
Fine?
Great.
Yeah?
Yes.
Perfect. So, as said before, we are Nevaro, and we are here to show you how we are revolutionizing mental health care. So, our main mission is to turn mental health tangible by prioritizing science-based innovation. So, understanding how the brain works, how it's connected, how we can see our state not only through self-reporting, but also to how our body replies. So also to our physiological activity, our behavioral biomarkers, and all these always resorting to a gamified experience. So our action goes all the way through mental health care in a clinical setting, but also understanding the performance, so with these biomarkers, as I just mentioned, as well as to foster well-being and take care of burnout risk cases. So our impact in all this action will cover the good health and well-being of the individuals, helping improve quality of life, the preventive approach, so this prevention way that usually people are not that aware of, as well as reduce the consumption of anxiolytics and antidepressants. We are working also to provide better workplaces by improving well-being, reducing burnout, and improving productivity as well as to reduce inequalities, providing a tool that can be available to anyone, anywhere, to work on their mental health. So as I said, we started working with the therapy approach, with this performance use case, also for monitoring our risk levels, as well as on coping. How can we cope day by day, and how can we improve it? So starting from where we are right now. So we developed Ollie, which is our mobile app that is helping to get out there mental health coping strategies in a personalized and preventive way. So capacitating individuals to have this self-care approach on their own every day. We know that every 1 out of 4 people in the European Union suffers from a certain mental health issue. The average gap between the onset of symptoms and the actually pursuing treatment is around 11 years. So the gap is huge. And in the top 30 worldwide countries of the biggest consumers of anxiolytics and antidepressants, 24 of them are European. So it's really a really critical scenario. And if we look closely, if the companies where we work are not treating the mental health of their employees, it will eventually lead to burnout. More than half of the employees are reporting symptoms, and that ends up having huge costs on lack of productivity and performance. So, as the old saying says, an ounce of prevention is worth a pound of cure. And therefore, the only sustainable way to reduce the burden of these issues is by acting earlier. For that, we introduce you to Holly. Holly is this small brain who will work as a personal trainer for mental health just a click away. So it comes to us as a mobile app, as you can see here, with this personalized approach, understanding how we are, how we're feeling, and what we need, and suggesting the right journey for us to cope with it. We have several positive psychology strategies that are widely used, but with this smart layer of identifying the risk levels through these biomarkers activity and behavioral activity, and with that, personalize the right journey for each one of us. So here's a practical example. This is a simple breathing exercise, and through the microphone, we understand the breathing rate of the user, and with that, suggest the right amount of time that should be performed in this exercise in order to regulate it. So we have this biofeedback technology that through the sensors of the smartphone, not needing any external hardware, only the smartphone, we allow this biofeedback. And for the companies we work with, we also provide reports on the global mental health metrics, of course, aggregated and confidential information, so no one can know who is who and who is feeling like what, but we provide aggregated reports on the global state of the company, of the workforce. So for companies, for these individuals we are working with, we work with three main pillars of prevention. The primary prevention, providing awareness, working on the culture, providing the tools so people know how to identify things. The secondary prevention, working on proactive mental health support, helping understand the early signs of danger and acting before they evolve into something worse. And finally, the tertiary prevention, where the problem has already been diagnosed, has already been treated with a clinician, and we work on maintaining the progress and working for improving the state afterwards. So all of this technology that I've just presented is based on this biofeedback technology, so translating physiological signals into emotional states, and it's our work from back in the day when we were still students in the University of Lisbon, where we started developing this technology. And now we are a spin-off company of the University of Lisbon, and we've kept on strengthening these algorithms, strengthening this evaluation mechanism that we have alongside other universities for now. We've also conducted several studies, and we've been presenting the results of such in the European Congress of Psychiatry for 3 years in a row. And this year we also were present in the World's Congress of Psychiatry. So we've been working on sharing this science, this understanding, these conclusions we've been getting with the scientific community. And how is Holly doing so far? So Holly is working hard on reducing absenteeism and presenteeism in companies, as well as providing, improving productivity, happiness and culture, the analytics we can obtain in the workplace, the retention of the employees, and also the psychological support engagement rates that usually are not that disseminated, not that used among the employees. Specifically, with a super large company we've been working with, we've gotten a stickiness ratio rate of 62%, which means during 6 months, which means that people, 62% of the users were returning week by week to use the app, which is really satisfactory in this stage. Also, in the course of this pilot, we had an improvement in 14% of the coping skills, which is mainly our target here with this app. So we were super thrilled by getting this. Regarding our competitive landscape, we differentiate ourselves through this hardware-free approach. So we can have this personalization, this evidence-based journey, not needing any kind of external wearable, only with the smartphone sensors, as well as with this continuum approach, with this transversal application across the several stages of prevention. So when did we start? How did we get here? What were the steps? Back in 2018, I was mentioning we were still students developing these algorithms. We tested it on a proof of concept. So we were working really hard on understanding the power of this tool to turn mental health tangible. And back then, we were performing these studies as part of our biomedical engineering course. But then we finished it. So we needed to find the funding, we needed to find the possibility to keep on working on this product. And we've been doing that by bootstrapping, so resorting to awards of competitions, also some research grants that we've applied to. And back in last year, we started having bigger financing, also with this the scientific and research grants, but also with impact funds. So we are a startup that's actively generating impact, being in health, being in workplace, being in reducing inequalities, as we presented in the beginning. So we have this impact fund where we have some main goals to reach. And every time we do so, we have another layer of funding being released. So so far, we've been we raised around 150K for developing our technology, for testing it, and we are soon to be launching the product in the market. Yeah. So this year, we started this piloting with companies, more in getting it out there as if it would be launching, but not yet. And now next year we will be launching. So we have two pre-launch paying customers. We have users all around Portugal and our islands, and we have more than 20 customer requests even before launching. But how did we get here? We needed to work hard on our technology. So we will take a quick look over it as well. So as I was mentioning, these algorithms that translate this physiological activity into emotional states started being studied with external hardware, like we can see in this video, but soon we upgraded it to this new version where we can obtain the same results, same quality of results through the smartphone sensors. So we combine gamification with this biofeedback and a home-based approach that the person can take it home using only their smartphone, so giving some independence also to the final user. We've gotten some clinical validation of our algorithms, having a 5 times faster anxiety reduction compared with the conventional treatment approaches, a 4 times improvement, faster improvement in quality of life, and several scientific publications on the topics. Here we leave you some feedback as well of the users of our strategies. So they reported that throughout the sessions, they were sure this was specifically for a kind of anxiety, which was phobias. So we were triggering a small amount of the phobia and also monitoring their physiological signals. And if the biofeedback worked in a way that if the person was feeling really anxious, we would reduce the stimuli, but also triggering a little bit. So they reported that they were sure of the panic, but it was good for them to get out of the comfort zone. And with this evaluation in real time, we can understand what kind of triggering they can support or not. So it was a really good approach. While at the same time, the clinicians of such study reported that the therapy was really useful as a complement to what they were doing already. So there is a lack in what is being performed, and this solution would fit perfect there, allowing the patient to have further breakthroughs even at his own home. So not only in the clinical setting, but also at his home. Finally, to get you through also this performance monitoring approach, we conducted a study with Hospital de Luz, where we use this physiological signal monitoring to classify the performance optimization. So here we are also talking about anxiety levels, but with a specific approach. So we can see here, instead of a phobia where we can trigger the stimuli with they would support with a certain kind of anxiety, here we are understanding how it's evolving and how a person that is reporting symptoms of anxiety can use it to improve their performance and not to be stopped from performing well. So here, as you can see, they are wearing headbands where we were monitoring these signals and then giving the reports and helping them improve. And I think it is blocked. No, okay. So to sum up, overall, we will give you also an overview on how we are shedding some lights on the topic of mental health. So we've been recognized both nationally in Portugal and internationally all over Europe and even the world, with some awards and competitions regarding healthcare, regarding the work we do with the workplaces, as well as our impact. We've been featured in this last year's edition of Sifted for Mental Health, and some Portuguese media coverage as well. And some more light we've been shedding. So last year we also gave a TEDx talk on how to break stigma with science. I don't know if I mentioned already, but we are engineers mostly in our team. So we really think it's important to back up things with science, especially in a topic as mental health, which sometimes can seem really up in the air and not as tangible as it should. That's why we are working on turning it tangible as well. So giving the science behind it, what is improving if I breathe a certain way, what a certain exercise will impact. So providing here the tools, the justifications, and how it works. So we've been doing that both through our communication in talks, and as you can see here, but also on our social media and the information we are posting. Also, we partner up with some public opinion shapers that align their vision with ours to get even further and reach even more people. Behind all this, there's a team incredibly passionate for the human behavior. You can see me and Francisca and Hugo. We are the three co-founders of the startup. Hugo has more than 15 years of experience in the field of digital health, and he was our teacher back in the day. And now the three of us were the founders of Nevaro, but we also count with André, Manuel, and Marco, who are, Manuel and André are more focused on the development part, the technical part, and Marco, our lead advisor in the clinical field. Of course, we also count with other incredibly qualified advisors from the occupational psychology to neuropsychology, psychiatry, to help us co-validate our solution, every content we develop, as well as in the fields of business, innovation, and strategy. We've also participated in some acceleration programs that really help us strengthen our team or our skills in certain aspects that we wouldn't have on our own, and therefore also help us not have that much cost in certain aspects that would be really expensive for us, and like this we can get really further on. And this is us, Nevaro. We all have a brain, so we all need to take care of it. We are really passionate by the human brain, as I mentioned, and we really want to make this to improve mental health by measuring it. So thank you so much. Feel free to reach out and ask all your questions, and we'll be here to reply to them. Thank you.
Thank you, Rita, for the great presentation and for showing the story how you've been growing. So that was a great pleasure to hear. So do you have any questions from the audience at this stage? I would perhaps warm up and just to say that or ask, have you thought about any potential regulatory requirements that you have to meet for the application?
Mm-hmm.
So is it something that you have to consider in the near future?
That's a really great question. So far we are not required to have medical certification, since we are only a preventive tool. But in the future we want to be a complement to mental health treatment, and in that moment we would really need that. So it's something that we are already planning. And for that, we would also need to raise an investment round, and that's the stage we are in as well. So far, we've been bootstrapping and we've been developing this preventive approach. But to move into the clinical setting, we would need the certification, yes.
Right, that would have been sort of you already answered part of my next question as well, that if, or how do you plan to set up your business model, and will you be looking to get some funding from the national reimbursement schemes, or will it be just privately sold? So I think you partly mentioned this, and you also said that you're looking for investment quite soon. So that's also very wrong.
Exactly. We have been taking advantage of both public and private funding schemes, so R&D grants, and also we have been exploring the EIT Health financing calls. So that's a very good financing aspect for us, because it's equity free. So it's our main goal in this stage was to don't give equity away, and to have our sustainability already from early sales, and these grants and financing from these aspects. Yeah.
Right. I see that Janos has raised his hand, so please, Janos.
Yeah, thank you. Very great presentation and great journey what you have done. Although I have still one thing which I want to challenge your statement that as you are a preventive tool, you don't need any regulatory approval. So actually the MDR states that any software tool that is claiming to actually deal with the diagnosis or prevention is considered as a medical device, which is actually class 2A and needs to be CE marked, to be to enter to the market.
Right.
So this is actually what MDR said. I don't know how you have been interpreting that this is prevention doesn't prevent you to get the regulatory steps to register the tool.
Yeah, we are aware of that, and the thing is that we don't do a diagnosis. We only do a screening of the risk for being in burnout. So in our interpretation and given the expert analysis that we've been talking with, we don't need any medical device.
Actually, Estonian authorities are on opposite opinion. They state clearly that as MDR is stating that as soon you claim that you actually are giving some feedback to the users for prevention, this immediately puts you to the under the MDR class 2A.
The thing is,
this is actually interpretation from Estonian authorities.
The thing is, we are combining information from tools that are already validated and are already they have their own independent process. Imagine we use a certain scale for screening anxiety that's already clinically used, universally validated, and we also integrate that in the evaluation. So our product itself is not a medical device, but resorts to information that comes from features that are evaluated as such already.
And another thing is that it depends on the use case that you are applying the solution to, because right now we are only applying the for companies, so it's not on a clinical setting, and therefore we don't influence a clinician's decision. So I think
I still advise you to find another second opinion, because it doesn't matter if it's for clinicians or for wider public. This is not the case. This is actually compared to the thermometer to measure the body temperature, which can be used both by professionals and by laymen, and this is actually considered like a medical device.
Okay, yeah, we have further
But
check.
just a comment.
Yes, thanks for that. Yeah, and we are aware that there have been some changes on the regulation, so we are still assessing because it's a kind of a complex matter. Yeah, thanks.
Thank you. So we also have a question from Tavi, I see. Tavi, please.
So,
Hi.
I understand that you're basically connecting the different parts of different services to onto one platform. But my question is then, why not just do like a fitness or wellness type of advisory? Why do you want to give clinical advice?
Okay, we first of all we don't we use some strategies that are not our invention, but we have a proprietary algorithm which is the model for assessing burnout, and also all the engagement is our own model. So we have that part that is our innovation. And your second question was why I don't know if I got.
Why not use this wellness or fitness type of let's say approach?
Okay, so our main target is mental health as a whole, and not only the physical part. So of course that are some common points with these fitness apps, but our goal is to have this mental health awareness, and also to work the several aspects of mental health. So the emotional, the physical, and that's why our app is called Holy. So we have an holistic approach towards mental health. I don't know if that answered your question.
But you don't have like a functional paid product.
What?
Like you don't have a paid product yet?
We are having some first sales, yes. But we haven't officially entered the market. So we are doing paid pilots right now.
Okay, so but you're jumping in with something you think that will work, but you haven't really like validated it on a business like landscape. So that's why I'm asking, why not approach from like a fitness or some kind of like a health motivation point of view, or maybe the market is oversaturated by these, I don't know, offers and technologies.
We are slightly working in the wellness market, but we don't want to be just one more wellness app, you know. We have this layer of complex personalization and evaluation, and that's what differentiates us from that kind of solutions. So we are not in the healthcare, but we are more in the wellness and well-being, working with companies right now, but doing this bridge between the people that start signaling with the first symptoms and the clinicians. So we suggest them to take the step and go to the clinician. So we are here bridging these two points.
Yeah, and also because this is the segment of the mental health care pathway that we see that as less solutions already in the market. So most of the solutions are more prone to the therapy side.
Okay, but now if you come out with your solution that's predictive algorithm, how you're gonna prove that your predictive algorithm created the value?
Yeah, that's a great question. So we intend to do a clinical study, of course, to validate the accuracy of the algorithm. so far we have been proving the receptivity, engagement of the app, and also the preliminary impact on mental health. But that's the next step to do a proper scientific evaluation of the model.
And how long that will take? Do you know?
We are still assessing because, of course, that this evaluation needs quite some time to have a proper evaluation. So we are still assessing it. Yeah.
Okay. So if you have a way to make money from the
Prizes.
Yeah.
enterprises market, then it's not a problem. But
Yeah.
We
it
are.
sounds.
Yeah. Sorry. It sounds.
Yeah, it sounds too hard.
Hard, yeah. We are starting with companies, so working with companies, so they provide this tool for their employees, for being a niche that now is really needing this kind of solution. But our main goal is to enter the clinical setting. So that's of course our priority in improving the efficacy of the solution, improving the isolated effect of our solution on people. So currently we are starting sales in this way with companies, but looking forward partnering up with clinicians so we can do these analyses as well.
But have you like compared yourself with other health or what's the other one? Like other health, I use other health, for example, for my physiological health. So
okay,
you know,
no, actually, we don't know what is the name again. Sorry.
ADA health. It's just the app. It's based on some kind of like determined questionnaire by AI. It's nothing special, but it works.
Okay.
Okay.
Yeah.
So the algorithm behind it is probably very good.
Yeah.
The other one is UK startup, really big. What was Babylon Health, but there is something wrong with them because they couldn't get it work on the market, and they're now trying to offer it to doctors as a secondary assistant. So they they have something wrong with their algorithm. But this other health one, this works. This I've tested myself. It's better than my family doctor, I know.
Yeah, of course that it would be a good addition to our study to have this comparison with those algorithms, those apps. Until now, we have only been doing a top level approach for that comparison. Yeah.
But by the way, is the like the scientific literature about these algorithms even open? Can you like access to the data at all?
No, it's our IP, so we try to keep it as secretive as we can. Yeah.
Trade secret protection. Yeah. So far.
But if you need to develop your algorithm, do you get help from the scientific literature? Is there any good journals or I don't know, like good platforms, good schools that put out a lot of this AI focus, health focus, good like articles or?
Yeah. We in the construction, development, and validation of the model, we of course did a literature review and also got inspired by some of the best practices and with the best accuracies. And we also use some of the clinically validated biomarkers. But our main innovation is using so combining both the biomarkers, the physiological activity, and the self-reported assessment of burnout and mental health in general.
But from the scientific like point of view, where do you get your literature, your scientific literature that you build your model on? What do you trust, or how do you find it?
We have, of course, several sources, but I'm not sure what are you asking in terms of.
Like, is there a certain group, scientific group, or certain university that gives out like high quality
Okay,
on this topic?
we don't have one specific that we can name, because of course this is a field that has been evolving, and there are several projects, research projects going on. So yeah, we can't nominate just one. Yeah.
But we mainly work with the University of Lisbon's. They have an Institute for Biophysics and Chemical Engineering. We mainly work with them, and the University of Aveiro, as well as Oxford Institute for Mental Health. They also have one. So these three of them are the ones we are more connected with.
Because right now what I'm seeing is everything is very project based. So you're gonna have, for example, very good article about something. The data is all closed, nothing is published, algorithm is not published, like only the specificity, some values, p-value, that's it.
Yeah.
And then next 10 years, nothing from that lab.
Yeah, right. Yeah, because it's hard to manage the translation parts to the commercialization.
Yeah, that's the tough one. Okay, thank you.
Thanks for the questions.
Thank you, Tavi. Do we have any other questions or comments to Francisca or Vida? There seems to be no hands up that I can see. So with that, I would thank the Nevaro team for joining us for the Friday evening and talking about their journey and their medical health or health tech application. And we wish you all the best of luck going forward. It's been a very, very nice journey, as we heard, and hope you're going to figure out all the other barriers that may come in your way in the near future.
Yeah, thank you.
So best of luck.
For having us.
Have a wonderful Christmas time, and I hope to hear from you again.
Yeah, have a nice
You too.
everyone. Thank you so much.
Cheers.